Let's break down mandatory reporting requirements, a topic the NCLEX loves to test through priority and delegation questions. The single most important concept to master is that your legal duty as a nurse is to report the suspicion of abuse or neglect, not to prove it. The exam will try to trick you with answer choices that involve investigating, gathering more evidence, or confronting a potential abuser. These are always wrong. Your role is to assess, recognize the signs, and report to the appropriate external agency immediately. Imagine a scenario where an 8-year-old child is admitted with a spiral fracture of the humerus. The parent claims the child fell off a bicycle, but you know from your training that a spiral fracture is often indicative of a twisting injury, a common sign of physical abuse. The NCLEX will ask for your immediate action. The correct answer is not to ask the parent more questions or to document your suspicions and wait. The correct answer is to follow facility protocol and make a report to Child Protective Services. Your responsibility is fulfilled by making the report in good faith. This principle extends beyond child abuse to other vulnerable populations, such as the elderly or adults with disabilities. If you see an elderly patient with multiple bruises in various stages of healing, signs of dehydration, and poor hygiene, you must report this to Adult Protective Services. The exam is testing your ability to prioritize patient safety and legal responsibility over all other actions. Furthermore, mandatory reporting isn't limited to abuse. You are required to report certain communicable diseases to the local or state public health department. The NCLEX will expect you to know that conditions like tuberculosis, measles, gonorrhea, and salmonellosis are on this list. A question might describe a patient with a positive AFB smear and ask about the nurse's reporting duties. You are legally obligated to ensure this is reported to protect public health. Another critical area is reporting specific injuries that may result from a crime. This includes injuries like gunshot wounds, stab wounds, or extensive burns suspected to be from a suspicious source. The exam will test your understanding that these situations require a report to law enforcement, separate from any other reporting duties. Let's think about a helpful way to remember this. Use the phrase, "If you see it, report it." SEE stands for suspect abuse or neglect, evidence of specific communicable diseases, and evidence of a criminal injury. This mental shortcut helps you quickly identify a reportable situation and links it directly to the action of reporting. The exam might also test your knowledge of the legal protections in place for reporters. You are protected by good faith immunity. This means if you make a report based on reasonable suspicion and without malicious intent, you are legally shielded from a lawsuit, even if an investigation later finds no evidence of wrongdoing. Conversely, the consequences for failing to report are severe and can include fines, loss of your nursing license, and even criminal charges. The NCLEX will present scenarios where a nurse hesitates or fails to act, and you must identify this as a breach of legal and professional duty. While reporting laws have slight variations from state to state, the fundamental principles of what must be reported and the nurse's duty to act are consistent and form the basis of what is tested on the exam.